Hello, my name is Yasmin. I'm a student nurse at Advent Health University. Today I'll be assessing the head to toe. I'll be doing the head to toe assessment. This will take approximately 40 minutes. Do you need to use a restroom?
No.
Perfect. I already washed my hands. May I please have your name and date of birth?
Marisol, December 19, 1999.
Perfect. The patient is dressed appropriately for the situation. The facial expression and the mood are appropriate for the situation. The patient does not seem ill. The patient seems clean. There is no odor noted. The posture is upright. The skin seems consistent throughout the body and is within the ethnic background. Okay. The patient is alert and oriented to the time and the place. Will you be able to stand and sit throughout the physical assessment?
Yes.
Perfect. There is no slurring in the patient's words. Can you hear me as I am speaking?
Yes.
Perfect. Do you use a walker or an assistive device?
No.
Okay, we're gonna go ahead and start off with the the head and the face assessment. Have you experienced any facial pain?
No.
Have you had any head injuries?
No.
Okay. The patient's hair is evenly distributed. It is dark brown and highlighted. There's no signs of alopecia. Do you feel any tenderness?
No.
Perfect. There is no tenderness on the scalp or lumps or masses or lesions. The patient has a normal cephalic without any deformities or lumps. The face is symmetrical. The skin color is consistent within the ethnic background. The face has a little bit of acne. Okay. Can you smile for me? Can you frown? Can you go ahead and go like this? Perfect. All right, we're palpating. The carotid artery is at a 2+ on a 4-point scale. Can you open and close your mouth for me? Perfect. Did you feel any tenderness?
No.
Okay. There is no tenderness or crepitus noted. Can you puff your cheeks for me? Good. Can you go ahead and take off your glasses? Just keep them at your side. Did you feel any tenderness?
No.
Okay, perfect. No tenderness was noted. Have you experienced any pain in the eyes?
No.
Okay. The eyes are symmetrical. They are dark brown. There's no unexplained hair loss in the eyebrows. The eyelashes curve outward. The patient is able to open and close the eyes with spontaneous blinking. I'm going to go ahead and turn off the lights. The conjunctiva is transparent with small blood vessels, small visible blood vessels. The sclera is clear, smooth, and has no signs of exudate. The iris is evenly distributed throughout. The cornea has no signs of lesions. The pupil seem to be about 3 millimeters in diameter. Can you go ahead and look at the tip of my nose for me? Perfect. The eyes, the light reflection, it reflects in both eyes and the same exact spot. Can you go ahead and follow your pen light with your eyes without moving your head? Perfect. The eyes move symmetrically and smoothly in all 9 fields of gaze. Can you go ahead and look at the wall? Perfect. The pupil is equal, rounded, and reactive to light. Have you experienced any hearing loss?
No.
Good. The ears are fully formed, the skin is intact, the tone is uniform, they are equal in size, and they are symmetrical. Do you feel any tenderness?
No.
Okay, there's no tenderness, lumps or masses noted in the ears, and they are firm. There's no drainage in the auditory meatus. I would go ahead and turn on the lights. I'm gonna go ahead and say some words, and I want you to go ahead and repeat them out loud for me, please.
1, 2, 3, ABC. ABC, 1, 2, 3.
Perfect. The patient is able to hear without any. The patient is able to repeat without making any mistakes. Okay. Have you had any recent nosebleeds?
No.
Okay. The nose is symmetrical in its midline, and the skin is smooth without any lesions or scarring. The nares are bilaterally equal. Can you go ahead and press against one nostril and inhale? Press against the other one and inhale. Good. There is no nasal obstruction in the airflow. There's no airflow nasal obstruction, and there seems to be no drainage in the nasal mucosa. Have you experienced any sores in your mouth?
No.
Do you have frequent sore throats?
No.
Okay. Can you go ahead and open your mouth for me? And can you lift your tongue? Stick it out. Good. There's no masses or lesions in the tongue or the buccal mucosa. Can you smile like this for me? All right. The teeth are aligned, and then there's no signs of decay. The gingiva is pink without any inflammation. Can you go ahead and open your mouth for me once again? Can you say ah? Perfect. The uvula rises with ah, and the tonsils are 1+. Have you experienced any neck pain?
No.
Okay. The neck seems symmetrical. There seems to be no pulsations. No lesions or masses or lumps noted. The skin is consistent with the body. Okay, we're gonna go ahead and do preauricular, posterior auricular, occipital. We're gonna have submental, submandibular, tonsillar, the superficial cervical, the deep cervical chain, the posterior cervical chain. The jugular vein does not seem to be distended. The trachea is midline. There seems to be no enlargement of the thyroid. I'm gonna go ahead and press my hand against you. I need you to go ahead and push whenever you feel my hand, okay?
Okay.
Good. Good. The patient is able to, has full range of motion with resistance. Have you experienced any chest pain?
No.
Okay. I'm going to go ahead and have you take off your top. Okay, the thorax seems symmetrical. The skin is consistent with the entire body, and it is within the ethnic background. Do you feel any tenderness?
No.
Okay, there is no tenderness of the thorax, and there's no lumps or masses noted. The skin recoils back promptly, therefore the skin is hydrated. I'm going to go ahead and have you stand for me. Whenever I say, whenever you feel my fingers, please say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Good.
99, 99, 99, 99, 99, 99, 99, 99.
Perfect. Spermatus is present. Perfect. Healthy lung tissue is resonant. Can you go ahead and inhale and exhale for me? I actually have you turn this way. Good. No adventitious sounds are heard. I'm gonna go ahead and have you lay down for me. Have you had any recent heart attacks?
No.
Okay. The precordium does not have any impulses. Can you lift your sports bra a little bit? I'm going to go ahead and feel your apical pulse. Good. I'm going to go ahead and hear it now. Okay, the apical pulse rate is 84. We have the aortic, we have the pulmonic. Can you lift for me one more time? We have the tricuspid, the mitral. One more time with the bell. We have the aortic, we have the pulmonic, we have the tricuspid, and we have the mitral. Perfect. Lub dub is heard. Okay. I'm going to go ahead and have you sit for me, please. There we go. Good. Have you experienced any stiffness in the arms?
No.
Okay. The arms, the skin color in the arms are consistent. The skin seems smooth, moist. The skin recoils back promptly, therefore the skin is hydrated. The hair is evenly distributed throughout the arms. The temperature is evenly throughout. Capillary refills in 3 seconds. Good. The brachial pulse is 2 plus, and the radial pulse. I'm gonna go ahead and have you close your eyes. If you feel something, say yes. Okay.
Okay. Yes. 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 Yes.
Continue to close your eyes.
Yes. 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 Yes.
Perfect. The patient's pain sensation and the light touch are intact. I'm going to go ahead and have you follow some of my movements for me, please. You can go ahead and stand up. So we're going to do forward flexion. We're going to do hyperextension. Keep your body straight. There you go, hyperextension. You're going to go ahead and do internal rotation, external rotation like that. Good job. You're going to go ahead and do flexion. Good for both arms. Extension. Good. You can go ahead and have a seat. You're going to do pronation. You're going to do supination. You're going to do radial deviation, ulnar deviation. You're going to do adduction. Perfect. Can you go ahead and go like this? All the way towards you. Good. And now palmar flexion. Good job. Can you make a fist? Go ahead and open them back up. Can you touch your fingers to your thumb like that? Good. We're going to go ahead. I'm going to grab my hand like this. Whenever I tell you to push, you push. Whenever I tell you to pull, you pull me, okay?
Mm-hmm.
But it's going to be towards you, okay? So go ahead and push. Pull. Good. Wow, you're strong. Can you go ahead and push? Good. Pull. Good. Can you squeeze my fingers? Perfect. The strength is bilaterally equal. You can go ahead and lay down for me one more time. I'm going to go ahead and do the abdomen. Have you had any abdominal pain?
No.
Okay. The abdomen is symmetrical and the abdomen is symmetrical along with the contour. Contour is consistent, and the skin is also consistent throughout the body. There are no signs of pulsations. There is no lesions or masses. The patient does not seem to have abdominal pain or tension. The umbilicus is midline. I'm going to go ahead and auscultate. Good. Okay. Let me know if you feel any tenderness. Any tenderness?
No.
Any tenderness?
No.
Good. There's no tenderness or masses. Okay. Have you had any difficulty walking?
No.
Okay. The veins are visible. There seems to be no signs of edema, ulcers, lesions, or varicosities. The skin is consistent throughout the body, and it's within the ethnic background. The skin seems smooth. The hair is evenly distributed. Can you separate your toes for me? Perfect. The patient is able to separate toes. The temperature is even throughout as well. Okay? I want you to go ahead and close your eyes for me, and if you feel something, please say yes.
Okay. Yes, 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 yes.
Okay? The patient is able to feel the pain sensation and light touch. They're both intact. If I were to go ahead and do the femoral pulse, it'll be right here. We're going to go ahead and do the popliteal pulse. Good. Good. Okay. All of the pulses are 2 plus. All the pulses are found in our 2 plus. We're going to go ahead and do the flexion and extension, flexion and extension. We're going to do internal rotation, external rotation, internal rotation, external rotation. We're going to do abduction, adduction, internal rotation, external rotation, abduction, adduction. Good. Can you go ahead and point your toes down? Point them up towards you. Perfect. Can you go ahead and turn them inside? There you go. And outside. Perfect. Just like that. I'm going to go ahead and have you sit back up. Have you experienced any dizziness?
No.
Okay, good. Can you go ahead and dangle your feet? Your legs, actually. Perfect. Thank you so much. I'm going to go ahead and have you walk towards the wall. Good. Walk back. Okay. Now this time what I'm going to have you do is you're going to walk heel to toe, heel to toe, heel to toe, heel to toe. There you go. Perfect. Can you do your tippies now? Walk on your tippies. On your toes. Sorry about that. Perfect. Can you walk on your heels? Okay. The patient has a steady steady gait. You can go ahead and sit. Thank you. Appreciate it. Okay. Now I want you to go ahead and extend your arm and have your index finger touch your nose twice. Okay. Now do it with your eyes closed. Good. The patient has well-coordinated movements. Now you can go ahead, it's going to be like patty cake. You can go ahead and have your palms on your thighs and alternate as fast as you can. Good. The patient has well-coordinated movement. And I'm going to go ahead and have you stand up. Perfect. And I want you to go ahead and just like that and close your eyes. There you go. Your arms at your side. We're going to do it for 15 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Perfect. You can go ahead and open your eyes. The patient is able to stand without opening their eyes. I need you to go ahead and bend one knee, stand on one foot. And the foot you're standing on, slightly bend it down. Good. Stand up. Perfect. Now do the same with the other one. Bend the other one and slightly go down and up. Perfect. You can go, I apologize. That was really good. If you can just go ahead and turn around for me and look down for me. Perfect. The patient has no scoliosis present. All right, we're almost done. If you can just go ahead and bend forward, bend backward, to your right side, to your left. All right, can you turn to the right? There you go. Rotate to the left. Perfect. This is actually the end of my head to toe assessment. Do you have any questions before I head out?
No.
Perfect. Thank you. You can go ahead and get dressed. You have a lovely rest of your day.
Thank you.